Tennessee Capital Report is made possible in part by a grant from Blue Cross and Blue Shield of Tennessee.
We're here.
Woo! Right here.
We're here. There's Jack.
We're so happy you're here.
Being here matters. That's why Blue Cross Blue Shield has thousands of people right here in Tennessee serving millions of members.
If you need anything else, we'll be right here.
So when it matters, wherever you go, we'll always be right here.
From Memphis
all the way to Bristol.
We really do change lives.
I love our members and they love us.
I'm here for one reason, and that is to help you meet your financial goals.
What we do is for the member. It's not for personal gain.
And that's why Tennesseans love credit unions.
Welcome to Tennessee Capital Report. I'm your host, Chip Hoback. The 111th General Assembly is now a working session for legislators, with 1,500 bills filed in both the Senate and the House. Each day, committees and subcommittees are busy hearing discussions and debates regarding every piece of legislation. With Republicans holding a supermajority, they drive the agenda, however. So on today's show, we'll examine some of the priorities of the caucus chairs. Senator Ken Yeager of Kingston and Representative Cameron Sexton from Crossville. One of February's biggest stories was the announcement of legislation that could change the way Medicaid is administered in Tennessee, with the goal of adding more of the working poor to TennCare's rolls. We'll talk to the bill's sponsors, Senator Paul Bailey of Sparta and Representative Timothy Hill of Blountville. We'll also hear from the Democrats who fear this bill will only lead to cuts in benefits for people currently in TennCare. Senator Jeff Yarbrough, the minority leader in the Senate, and Representative Gloria Johnson from Knoxville. But first, we're also now seeing the rollout of legislative proposals from Governor Bill Lee. We spoke with Leader Jack Johnson about the governor's new emphasis on VOTEC education.
Well, just last week, Governor Lee announced what he is referring to as the GIVE Act, G-I-V-E, which stands for the Governor's Investment in Vocational Education. I'm very excited about that. It's something Governor Lee campaigned on, is expanding vocational technical education in the state of Tennessee. There are two critical components of the GIVE Act. One is to double the number of dual enrollment courses that a high school student can take. Currently, they can take 2 of those and receive scholarships to pay for those classes. So these are classes that kids are taking in high school, but also give them college credit. Governor Lee is proposing to double the number of dual enrollment courses a high school student can take to 4 and receive scholarships for that. So it's an expansion of the dual enrollment program. The second critical component of the GIVE Act is expansion or creation of community grants, which will build upon the LEAP Act, which is the Labor Education Alignment Program. It's another acronym, the LEAP program, which provides funding for high schools to offer vocational technical education. So really, if you think of it, we're going to expand the availability of VOTEC education in high schools for those that have it and make it more available, and then we're going to allocate some funding to create programs in high schools where it's not offered.
My first guest on today's show is the Republican caucus chair in the Senate, Senator Ken Yeager from Kingston. We just saw a clip of Leader Jack Johnson talking about Governor Lee's VOTEC and AD education proposal. Tell us about how that's going to involve your area.
Well, it certainly will have an impact on my area, which is largely rural. And in fact, 3 of Tennessee's 15 distressed counties are in my district. So we're excited about the governor's proposals, which is called GIVE. There will be an infusion of we think about $25 million for equipment purchases through the career and technical education program in our high schools. And that will help us be able to provide a better program for our students. And then additional funds will be made available for students to get additional dual credit courses paid who are in the CTE or the Career Technical Education Program, and while they are in high school. So it's a real ambitious program that I think will have a positive impact to get kids into the vocational programs, into our colleges of applied technology, where I presume that they'll get the dual credit courses and be able to learn trades or have skills that will be able to get them right into the job market.
So now it's 2 credits and it'll be 4 credits toward college.
That's correct.
Okay. What about the ag education part of it?
The ag education part probably still needs to be fleshed in somewhat, but there will be an emphasis from the governor and more announcements about that a little bit later, about infusion of funds of actually restoring agriculture programs in the schools. Now, in my district, which I said was very rural, we already have some agriculture programs that are already available, but you'll see those spread throughout the state in some of the rural areas.
One of the new things we're hearing about is called Senate Joint Resolution 1, basically where it defines the process of how to pick the Attorney General in the state of Tennessee. So what's the current way that's done and what's the proposed way that's done?
Tennessee is the only state in the nation that employs the current system of allowing the Supreme Court to select the Attorney General for the state, who's the state's lawyer. And this has historically been done in chambers, i.e. behind closed doors. I think that it ought to be brought out into the sunlight, and so we have filed the amendment to make some changes in the way we select the process by giving the legislature an oversight confirmation role. The Senate Joint Resolution 1 retains a role for the judiciary in this process. They won't make a nomination. However, that nomination will have to be made in open court with a recorded vote, and then the nomination will be sent to the legislature, who will have 60 days to confirm or reject the appointment. So it brings it out into the sunshine, and it gives a role for the officials who are actually elected by the people in the process.
So on the federal level, the president picks the Attorney General and then it's approved by Congress,
That's
right?
correct.
So on the state level, why not have the governor selected and have it approved?
And you could make that argument, others have, but the founders are the founders are our state founders, and then the authors of that Constitution, subsequent constitutions, have always left that role to the judiciary, and because of that tradition, I didn't want to make that change in my joint resolution.
Okay. What kind of support, what kind of opposition are you seeing for this?
Well, I got it out of the Senate Judiciary Committee on a 7-2 vote, so we had some good bipartisan support in that committee. I was able to get it through the Senate last year with a strong vote, and I expect that to happen again this year. Last year, it got bottled up in the House, but we're optimistic that we'll get it through the House this year. We've got some strong sponsors.
All right, Senator Yeager, thanks for being a guest again on Tennessee Capitol Report.
Oh, glad to do it.
Joining me now is the Republican caucus chair in the House, Representative Cameron Sexton. Congratulations on your new position. How's it going so far?
Thank you very much. It's doing well. We have a whole new leadership team with new speaker, new leader, new caucus chair. It's going real good. We're a good functioning team, and we're working well together.
There seems to be a lot of changes that have happened in the House and the Senate this year, a lot of new people involved. So how much of that process is education?
There's a lot of, we have 20 new Republican members on our side that are trying to learn the process, and there's going to be a little bit of growing pains over the next few weeks as they go through that process. But come about mid-March, I think we'll be a well-oiled machine and be going pretty well.
What are some of the priorities of the Republicans in this legislative session?
Yeah, I think there's some health care priorities. I think education with what Governor Lee's wanting to do is going to be a priority. I think criminal justice reform is a priority. So I think there's going to be a wide range of things that we're trying to accomplish this over the next 2 years.
So later in the show, we're going to be talking to Senator Bailey and Representative Hill about the Medicaid block grant request legislation that's going on right now. Give us a quick thought on that.
Yeah, you know, President Trump has offered to help states become more innovative and have more control. And one thing we've been talking about for a long time is how we can get more control of the TennCare program instead of having to ask for permission. And basically, if we can have the control, we may be able to save some additional money. But what it will do is maybe allow us to enhance services or expand services, or restore provider cuts. So we're looking at an opportunity to have more flexibility to where hopefully we can enhance what we currently have.
Okay, other than that, focusing on healthcare, what are some of the other key initiatives?
Well, you know, here in the next little bit, I think we're going to start rolling out a healthcare plan on things that we want to accomplish, and it's going to be a patient-centered form type of plan. Right now, if you look at how insurance is structured, it's the insurance company or the government that's kind of dictating everything. So if you're the spoke of the wheel, insurance in the middle, and everybody else is on the outside reacting to insurance. We got to put the patient in the middle, patient-centered, and put the insurance on the outside with the other things to really have a difference, to lower costs, improve access, and make things more affordable.
Now you're able to compare costs of different procedures and all that. Is that part of the focus on the patient?
It is, but I think with the Trump, what he passed down is a little complicated because the way that it's come down is when you look at the insurance companies, you have to know the 15 things that go into that procedure, which you may not as a consumer and probably don't know. So we're looking at trying to streamline that and really get it to a point where the patients really know what there's going to be cost. You know, one of the problems with healthcare, it's the only commodity where you don't know what the cost is until 60 days after you've done the procedure, and that's not right. You can't have competition, you can't lower costs if you're spending dollars and you don't know what it is till 60 days after the procedure.
One of the focuses on rural health care. There are rural hospitals that are closing. What's the plan to provide health care in those rural areas?
Yeah, I mean, that's a very good question. I think a lot of times the members on the other side of the aisle, Democrats, use the rural hospitals struggling as a way to try to promote socialized medicine and expansion. And really what we need to really focus about is why they're having those struggles. And when you look at it, they have a low patient population. They might not have enough providers in the area. They're having a hard time recruit providers in the area. The reimbursement from Medicare, which is a huge issue, is less for rural areas than urbans for the same procedures. And so if you're looking at why rural hospitals are struggling, it's not so much because you don't have expansion, as the Democrats like to say. There's other factors going into it. And then also you have hospitals who are within 15 to 20 miles of it. And having two hospitals in a rural area that close, it's hard to make both of them competitive and successful. And so what you've seen is things to go back in those areas is we're looking at trying to have certificate of need again, but kind of loosen that a little bit more to help the rural areas of Tennessee where if someone wants to invest money to come in there, they shouldn't have to go through the state government for permission. They should be able to do that themselves, and that will help improve the marketplace.
Is part of that focus too a shift away from emergency rooms into more walk-in clinic type situations?
It very well could be. It very well could be. And also use a mobile imaging in those areas because, you know, maybe someone's not going to go in and put an imaging center in those areas, but loosening it to where mobile imaging can come in to their doorstep instead of them driving 45 minutes. But the real problem in rural areas is they have the same desire that we have, but we need to do a better job of maybe having physicians to serve those areas, and that's through residency programs. There's some bills here to improve the number of residencies we have in the state of Tennessee, which would help us. But also really looking at the factors and what areas can we do to provide some level of health care in those areas. As if you're having a stroke, somewhere you can go to get stable before you're being transported. So I think with a healthcare evolving marketplace with more insurance dictating what it is and that reimbursement rate that's killing those rural hospitals are more of a federal issue than state issue, that's a huge reason why they're all struggling.
Republican Caucus Chair Representative Cameron Sexton, thanks for being on the show.
Thank you for having me.
Continuing our theme on health care is Senator Paul Bailey of Sparta and Representative Timothy Hill of Blountville, who shared some big news recently about the Republican plans for Medicaid and some of the uninsured in Tennessee. Welcome to the show. Thanks for joining us.
Thank you for having us.
We'll start with you, Senator. What is the history of this and why take it on now?
Well, I think that Tennessee has an opportunity to bring forth an innovative program that could basically sweep across the nation in asking the federal government for a Medicaid or TennCare waiver. Our legislation is basically asking the governor, Governor Lee, to request this waiver to be able to bring about an innovative program, Medicaid program for the state of Tennessee.
So you're sponsoring it in the Senate, you're sponsoring it in the House. What are the key issues that you think are involved in this as far as giving the state control of the Medicaid money?
So the money that's in place, that's already Tennessee taxpayer dollars. What the overall goal is to use is to use existing resources to serve as many people as we can across the great state of Tennessee. With the requirement of the request for Medicaid block grant dollars, we're trying to eliminate and at the very least reduce the cost of compliance and take that money and put it toward the actual care of the people who are in the most need in the state.
So if it passes, the governor requests the money, what happens there?
From there, CMS will take the governor's request, they'll review it, they'll probably ask the director of TennCare to provide a detailed plan as to how we would restructure TennCare and how we would move it forward.
Okay, so in the past, some of the Democrats have asked for Medicaid expansion. What's the difference between that and what they proposed in the past?
Medicaid expansion, as it has been traditionally suggested, is more money, and trying to fix the problem. What we're doing is we're taking a conservative approach, and we want to do it the Tennessee way. We want to streamline the program. We want to, like I shared, eliminate the cost of compliance, but we're trying to get the help to everybody that we can. The Tennessee legislature is not going to expand Obamacare, and I would argue wisely, is not going to expand Obamacare and expand Medicaid in the style of Obamacare. So we have the choice of not expanding it, and we've demonstrated that we're not going to do that. And so then the question becomes, well, what do? We can sit back and say, well, we just can't help the folks, or we can try to come up with a conservative solution to meet that need. And this is the first step in the process.
It's been estimated there's 150,000 or so uninsured working poor in the state of Tennessee. So what does this do for those people?
Well, I think once the program was implemented and we restructure TennCare with the cost savings that we have, we would be able to begin covering those that are working poor and bring medical coverage to them. You know, again, the details would have to be worked between the legislature, the executive branch, as well as TennCare in developing that program. Now, to say that once the waiver was granted and TennCare was restructured, that we would immediately cover 150,000 people, that's going to probably take just a little bit of time, but once we have the program in place and the cost savings that we'll see just through the administrative cost savings will begin to cover more people.
There's a step between when the bill passes and the federal government. It's the governor, Bill Lee. Where does he stand on this?
Governor Lee has made a statement that he is in support of our legislation as well as revamping TennCare. This has been something that Representative Hill and I both have worked with our TennCare director as well as the Lee administration to make sure that we're all in lockstep, that we're working for the common good of the people of Tennessee.
Of course, there's a supermajority of the Republicans in the House and the Senate, but what kind of bipartisan support are you getting on this?
Well, on this piece of legislation, we want everybody to join in because the concept's so broad, and it's the right thing to do. It's the right thing to do for Tennesseans. It's the right thing for the legislature to do. And of course, if you have a supermajority, there's tremendous momentum behind it. We want broad support. We want everybody to come to the concept. Don't worry about the party. Don't worry about what bias that you may have. Review the legislation that sits and vote on it on its merit. And so we want everybody to come on board, but at the end of the day, the Republican supermajority is going to lead through Tennessee. We're going to be a national example. We want everybody to be on the train, but at the same time, I believe we have the momentum to pass it as it sits.
The co-sponsors of the block grant Medicaid request, Representative Timothy Hill and Senator Paul Bailey, thank you for joining us on Tennessee Capitol Report.
Thank you.
Thank you.
There are many people in Tennessee who are disappointed the General Assembly didn't expand Medicaid when Governor Haslam was in office. And here with that viewpoint and more are Minority Leader of the Senate, Senator Jeff Yarbrough, and Representative Gloria Johnson, who is also making her debut on Tennessee Capitol Report. Thanks for being on the show.
Thanks.
Let's start with you. One of the things the Republicans are proposing is the Medicaid block grant request legislation that's going in. What's your views on that?
Well, I think that's pretty obviously a step in the wrong direction. That would not expand coverage to a single person. and really would actually diminish coverage for the people who are already on TennCare. I think that it's pretty irresponsible direction to go, even if it could become law, but it probably can't because the block grant is not actually legal under the federal law.
Is that proposed to be changed, or what do you think the direction is going on that?
Well, there are talks about it somehow being changed by Trump making it change, but the problem is as soon as he does that, it will go to court, and it's most likely not going to stand up.
So what's your proposed changes that you would like to see made?
Well, I mean, I think that first, the legislature needs to stop being an obstacle in this. It's very unusual that we have this process where we have a sort of a legislative permission slip at the end of a negotiation. But the evidence is clear that what states should be doing is expanding Medicaid. The Affordable Care Act's been the law of the land for almost a decade now. We're getting to a place where only a handful, around a dozen states, have not expanded. Of the 38 to 40 states, that have, the data that's come in has shown that it's improved healthcare access, it hasn't hurt state budgets, it's improved economics, and it's slowed the closure of rural hospitals, all of which are things that all of us should be able to agree would be good in Tennessee.
By not expanding Medicaid, was Tennessee losing money from the federal government?
Tennessee is. We're leaving $1.4 billion a year on the table with a B. Yeah. And we're suffering because of it. Like Senator Yarbrough said, rural hospitals closing. So take a look at the studies that just came out from Ohio and Michigan who did decide to expand. In Ohio, they have greatly decreased the number of uninsured. Those participating in Medicaid expansion who have opiate issues, of those who have opiate issues, 96% of those with opiate issues in Ohio have received treatment. Imagine if we could say that in Tennessee. And in Michigan and other states, the economy has so improved that they are easily able to pay and predicted to be able to pay that 10% for as long as it goes, because it has increased that. And what we're seeing in the working poor, where it's expanded Medicaid, their credit scores are increasing. They're getting back to work. They're coming off of it because they're getting jobs, because they're able to get medical care. They're getting jobs where they have insurance on that job. So we are seeing wonderful work across the country with the states that have expanded. And one idea with our rural hospital closures in Tennessee, why don't we accept that expansion money and make some of these rural hospitals addiction centers for folks with opiate issues, because we see a lot of that in the rural areas. So let's think about how it works, how Medicaid expansion can work for Tennessee. We don't have time to wait for federal laws to change on block grants. We could vote on this tomorrow, right? I mean, we really could. And so let's do what's available now. If they want to tweak and make changes, think about that. But let's get these people care. Let's get my friend Tracy with her second bout of bladder cancer with no insurance. Let's take care of Tracy before it's too late to help Tracy.
What are some of the other medical healthcare related issues that you want to focus on?
Well, I think that Democrats want to work with Governor Lee and the supermajority on issues across the board here. I think that we share common ground on improving the status of rural hospitals. I think we all want to battle the opiate problem. I think we all want to improve mental health care and behavioral health care. The problem is that step 3, 4, and 5 of every one of those plans leads you back to the same spot, which is we don't have the revenue structure to fund those programs 100% with state money, but we do have the same tax dollars from Tennesseans is sitting in Washington ready to be used for those purposes.
So apparently the governor has said that he's not going to support Medicaid expansion. The supermajority says they're not going to support Medicaid expansion. Is there some kind of middle ground, or what's your plan? Are you going to oppose the block grant request, or are you going to try to work in some middle ground area? What's the plan?
I mean, I think the block grant proposal is not at present a really serious starting effort, because it's probably not going to survive any legal analysis and to be able to go forward. The governor's expressed some opposition to traditional Medicaid expansion, but there are a lot of states who have negotiated very particular ways of tapping into those resources and changing the Medicaid program in a way that works for their states. We have and will continue to work with everybody who wants to improve health care in the state of Tennessee. And if anybody comes to the table with a good faith proposal, they will find partners. I don't think that, at least in its current form, this block grant proposal isn't that good faith first step.
Senator Yarbrough, Representative Johnson, thanks for being on Tennessee Capitol Report.
Thank you.
Thank you.
Well, that's our show for today, but you can always watch our replays on YouTube or your local public television station's website. A link to our digital content and bonus video clips from our interviews can also be found on Facebook. Follow us on Facebook for additional content and exclusive reports as this session of the 111th General Assembly continues. We'll see you back here in March for more insight from your state legislators. And as always, thanks for joining us. I'm Chip Hoback.
Tennessee Capitol Report is made possible in part by a grant from Blue Cross and Blue Shield of Tennessee.
We're here.
Woo! Right here.
Right here. There's Jack.
We're so happy you're here.
Being here matters. That's why Blue Cross Blue Shield has thousands of people right here in Tennessee serving millions of members.
If you need anything else, we'll be right here.
So when it matters, wherever you go, we'll always be right here.
From Memphis all the way to Bristol.
We really do change lives.
I love our members and they love us.
I'm here for one reason, and that is to help you meet your financial goals.
What we do is for the member, it's not for personal gain.
And that's why Tennesseans love credit unions.